Welcome students to the HIT orientation. This is going to be a shorter version than I actually had in the classroom. So let's go ahead and start here. I am not going to go through the whole handbook, but this is something you need to know. This is your responsibility to read through everything, okay? And I'll make note of that as I go through the presentation. So let's go ahead and start here. Table of contents. Go ahead and if you click on something, it'll take you right to that area, which is kind of nice. So keep that in mind. So if you're looking through the table of contents and say, hey, I want to learn more about, go down here, professional practice that's coming up in the summer, you should be able to go right to the quick facts, or right here, professional practice experience. Click it, and it's going to take you right to that area. So just a little FYI. Okay, so let's go ahead and bypass the table of contents and get started. Okay, so my name is Michelle Grant. I am the program director for the HIT program. I have been here 25 years at NICC. Before that, I was at Medical Associates and I was a outpatient coder for them. I did auditing and I also did some insurance. I also have a background in hospital coding. I did that for a couple of summers at Mercy Hospital. So it gives me a wide range of experience. Andrea Kane is our other instructor that you will have. And she has a wealth of experience, not in the teaching role as long, but she's doing a wonderful job, and you will see her bio in any class that you take with her. Okay, so the other important names are listed here, but the one here that you need to know is Laura Menke. She's the Dean of Allied Health and Human Service Education. She's going to be the one that you need to talk to if there's any problems that you can't resolve between Andrea and I. But let's hope you always come to the instructor first. Okay, and then Allied Health and Human Service Education, the academic assistant, Sarah Getkin, and the compliance coordinator, Daniel White. And we'll talk about what she all has going on with Castle Branch and what you're going to have to do. Okay, so as listed here, we have student resources. So Kelmar campus, we have counseling services, learning center, we have accessibility services. So any of these utilize these webs, these little links are going to take you where you need to go. So about this manual, one thing is it's just to give you information and guidance regarding your chosen program. So basically the HIT program. So also the college catalog, you can go there and check that out. NICC, as you can see here, make sure you tap on each of our policies here. Make sure you read through that because once again, it's your responsibility. Okay, general college information. So basically, NICC is accredited by the HLC, Higher Learning Commission. And here's our vision statement for NICC in general, the outcomes. So you will see these outcomes in all of our syllabus, whether it's going to be, a lot of them are going to be critical thinking, some we have communicate effectively, some lifelong learning, some diversity. But we will have those stated in all the syllabus. So make sure you read through the ethical practice, our non-discrimination statement, and our admission policy and procedures, which if you are in this course, in this orientation, you have been admitted to the college. All right, so let's work our way down here. One thing with this, with everything waitlisted status, this program does take quite a few students, so we are not usually waitlisted. Okay, so NICC college policy and procedures. One thing to remember is that we do have accommodations for those who need it. And I do need written documentation if you feel that you do need some accommodations where this could be somebody possibly to take your notes, possibly to test longer, anything like that. But I have to get that accommodation note from you. And this expires every semester. Keep that in mind. So each semester you have to fill out the written documentation and it gets sent to me each semester for me to allow any accommodation. Okay, program assignments. We'll talk about that when we get a little bit more in there. These are really labeled out into your syllabus. Behavior. Now, keep in mind, I know that we are online, so a lot of this isn't going to, you know, comply to you. But one thing I do want to keep in mind that when we do our professional practice, that a lot of this will, and it will apply to you. You will have to comply by it. If I mix those up. So a lot of going on there. We have bloodborne pathogen training. Yes, you will have to do that, and I'll talk a little bit about the Castle Branch as we further along in the handbook. Campus closing, we really don't have to worry about that. Cell phones and devices, children, I'm not worried about that. Unless, FYI, unless you have one of your gen eds here on campus. So if you had med term, and A&P, diversity, culture diversity, any of those courses on campus, then you need to really read through these sections. All right. So graduate job references, yes. Andrea and I would be happy to give you a job reference. Just read through what we are allowed to do. Okay, I'm going to. These here are health related issues. This is more going to relate to when you go out to your professional practice in the summer. Okay, so we also have HIPAA awareness training, which you're going to have to complete. Keep in mind it's HIPAA, HIPAA, and these are going to be for confidentiality. Student in a health program, they must contact with confidential protected health information will occur. So you as an HIT student, you're going to come across a lot of protected health information. This information may be personal, clinical, financial, or other. So you're going to be signing copies before you go out. You're going to have to take a short quiz, sign a waiver, that type of thing on confidentiality. So keep in mind that the confidentiality of the patient must be protected by the student. Access to patient information that you are not assigned to care for, research is prohibited. This includes your own personal health information. So, example, let's say you go out to professional practice to a place that you actually go to the doctor. You cannot go into your own personal health information unless you get a waiver signed and somebody sits with you. I do not want anybody to get in trouble because actually this is grounds to get expelled from your professional practice. And actually, it could happen where you get taken out of the program. So, the same thing with any family, anything like that. Only go in medical records that are assigned to you. Keep that in mind because, once again, if they see you in somebody's record, and it's not if they see you, if they do an audit on all the records you were in that day, you could be again terminated. So, okay, housing, we do have college suites, incident accident reporting. If something would happen, all incidents you have to do NICC report it. This could be anything from slipping on the ice, something happened at your professional practice. So keep in mind, make sure you come to this area and fill out your report. Internet and email. Okay, I'm just going to kind of piggyback on this. Um, this is more what we have to do as an instructor to report it if something would happen to you. Just make sure if you're a student that you would make sure you let us know. Internet and email. With that, potential employers routinely check social media postings prior to the interviews and hiring of employees. Now, this also goes with professional practice site. So, a couple of different things is students must recognize that postings on social networking sites they can be copied and sent to other individuals who have shared access to that personal site. Therefore, deleted personal postings will continue to circulate and are considered to be permanent postings. So, with that, just make sure you have your settings and just watch what you post on social media because it really can come and backfire on you in the future. Okay, so I need to get back to where we were, so give me a second here. Kind of went back on me. So the Iowa Core Performance Standards. So Iowa Community College have developed the following core performance standards for all applicants to healthcare programs. So these standards are based upon required abilities that are compatible with effective performance in healthcare careers. So go ahead and read through these. These are what you will accomplish after your 2 years. So I'm not going to read through each of these. All right, name address change. So if this would happen, once again, all you do is click this. It's going to help you complete a form for your name address change. Make sure you look at your My Campus and ACC for your email. Program orientation, that's what we're having right here. The big thing here that you're going to have to work on, and we'll go into that a little bit more coming up, is your immunizations and backgrounds check. They must be current and submitted to Castle Branch. So Danielle, the one I had at the beginning, she is going to be the one that you are going to contact with. And with Danielle, she's going to show you how to use Castle Branch, all that good stuff. So if you click on Castle Branch, it'll take you there. But I'm going to shortly show you what you all need. Okay, so possibly students may need a performance improvement plan. If you're doing poorly in a class, it could be something that we write up to say, hey, how can you improve? What steps can be taken? And this could be a warning to students that their continued status in the program may be in jeopardy, that either academic or professional improvement is needed. Hey, plagiarism. Everybody should know what that is. That's completing an assignment. If you obtain that information from a resource, it's expected you cite the reference. Make sure when you use the reference, you may not copy from that source. You need to paraphrase the information in your own words. So go ahead. Once again, this is all in student conduct. You can read through everything on plagiarism and visit the site. Pregnancy. We do not discriminate against pregnancy. You can once again read a little bit more about that. So students are encouraged to work with faculty members and NICC to devise a plan on how best to address the condition as their pregnancy progresses. Anticipate the need for leaves, minimize the academic impact if they're absent, and get back on track efficiently and comfortably as possible. So one thing to remember, the student does have the option of whether or not to inform the program officials of a pregnancy. So if you choose to inform the program of pregnancy, it has to be in writing, indicate the expected date of delivery. If the absence of this is voluntary written disclosure, a student cannot be considered pregnant. So if Andrea and I have not heard from you, we again assume that you're not pregnant, and especially being online, we have no clue. So just kind of read through here. Um, if you do declare the pregnancies, we do have options. So go ahead and read through those. Program failure. Students may be failed out of the program as a result of a critical incident in the program. And this could be anything to do with HIPAA or failed the course twice, which will not be allowed to re-enter the program. You could possibly re-enter, and at that time it would be you would have to set up an appointment with me. We would discuss the re-entry into the program. And you may only retrack back into the program once. Okay, so make sure here you visit the refund policy for tuition. This here will tell you how many days before you get 100%, how many days 75, and so on. Smoking policy, keep in mind that NICC is smoke-free and all our professional practice sites are smoke-free. So with this, keep in mind you can't even do it on the facility grounds. So if you're out for lunch, you leave the facility, then you can. Do not get caught doing e-cigarettes, vaping. They are prohibited also. And students who do so will be penalized according to college or to the facility protocols. Social media, okay, so make sure you go through the guidelines of any social media account. Okay, so NICC student conduct, this is all part of NICC, so make sure you review all that. If you are going to withdraw from the program or even a class, you need to contact NICC advising office. All right, so let's get into the HIT program itself. So what are we going to learn about? We are going to learn a lot. So we're going to learn the quality of the medical record by verifying the completeness and accuracy of the health record. The technician, we're going to learn software applications to assemble, analyze that patient data for the purpose of improving patient care, monitoring costs. The HIT is a specialist in coding diagnosis and procedures using the ICD and CPT for healthcare reimbursement and research. Most HITs work in hospitals, but we have so many other students that work physician practices, long-term care, home health agencies, mental health, public health centers, and cancer registries. So there's such a wide array of things that places that a student can work or potential HIT graduate. The other thing is different things that you can be doing. You could be doing medical, administrative, ethical, legal, anything with the regulatory requirements. The program provides HIT with the knowledge of everything below, which will help you succeed in any workforce that you decide to go into. At the end of your 2 years, when you get that Associate of Applied Science degree, at that point, you are eligible to write for the RHIT exam. Once again, go ahead and click on that too. With the RHIT exam, it's just kind of a way of, after 2 years, stating, hey, I retain this information, I am certified. Pretty much every place in the area is going to require an RHIT. Okay, after you get your RHIT and you get into a position, let's say a coding position, or clinical documentation improvement, you can write for different certifications. So keep that in mind too. There's so many different certifications that can be had from this program itself. But the first one we want to reach for is the RHIT. Okay, quick facts about the program. It's going to take 2 years, 20 months, 21 months to complete. You will receive an Associate of Applied Science degree. Graduates with an associate's degree are eligible to write for the RHIT, which, yes, you need to do. NICC is part of the HLC. And then our program itself is accredited by CAM. We have 3 colleges in Iowa that are accredited from CAM. So we only have 3 colleges in Iowa that can write for their RHIT. So pat yourself on the back for picking NICC because we are one of them. All right, program cost, couple of different things here. Students, start working on your physical examination and start updating your immunizations. These are required for all students prior to the start of professional practice. So the cost is going to depend on your provider and the number of immunizations required. So this can range anywhere to 125 and higher. So when we get into Castle Branch, okay, I kind of been talking about this. Castle Branch is where you're going to register that physical, register your immunizations. Castle Branch always also does a background check on you, and this is going to cost right around $103. So with that, this fee is added to tuition in the spring. Okay, included in that is going to be drug screening. So the college does not perform or require drug screening for college or program admission, but your professional practice sites will. So we will work with you. Danielle will work with you on where we will have you get that drug screening done. So don't worry if you live in the west side of Iowa, Minnesota, Wisconsin, we will figure out a place for you to go and get drug tested. All students are going to be members of AHIMA. They pay a yearly fee. This does come out of your pocket, but it is such a great thing to be a part of. You will see different references, career assist. They have many jobs posted. And for you to take your RHIT, you have to be a member. And when you go to the state meeting your second year, I'll talk about that. Once again, you also have to be a member of AHIMA. Identification badges. All students will be required to wear ID badges at your professional practice. So these are free of charge through the college library. So one thing for you to do is try to make it to one of the campuses. Piaster, Kalmar. Otherwise, go ahead and call and see what they can set up if you do live too far away to come to campus to get that badge done. Okay, travel, lodging, clothing, that's your expense for professional practice. The other thing I want to talk about is a HEMA state meeting. This will be in your second year, second semester. In the past, the meeting was 2 to 3 days event. It's held in person, alternating location within Iowa. Usually this year coming up, it's going to be again in Des Moines. Our second year students are required to go. We have made arrangements before if we have students out of state, they go to their state meeting, which we have no problem with. One nice thing with this, you do pay some towards us in your tuition. So we'll talk more about the money component when we get closer to your second year. All right, so certification exam. We are working to get that put right in tuition in your second year also. All right, so we have the curriculum. Here's our education plan. Might be a little hard to see. We start off here. A lot of these courses can be taken on campus if you want, like in your BCA, Intro to Computer Business Apps, A&P 1, Med-Term, College Experience. We also have A&P 2. We have Composition 1, Professional Practice Experience 1 and 2 have to be on site. Okay, these are the only courses that cannot be taken. They're online, but you have to go 64 hours this summer of 2024 coming up to a site. So that means if you have a job, if you have daycare, you need to make arrangements. So start thinking about that now. Next summer, you will have to go out 8 full 8-hour days to a professional practice site. Andrea and I work with you to get these set up, and we try to get sites set up fairly close. The furthest we've had students this past year drive would be an hour. So just an FYI, something to prepare for. Now your second year, in the second semester, we have Professional Practice Experience 2 in the spring. And once again, that is going to be 12 days total. And then keep in mind, you're going to have state meeting. So just something, once again, these cannot be done online. Some sites like Mayo Clinic may do some hours online. We're kind of working out that a little bit. But at this point, we recommend that you start figuring out how you're going to take off that time. All right, so these are just different courses. A lot of you are in these courses right now. Health Records Management with me. In the spring, you're going to have ICD-10 coding, which is diagnostic. You will also have legal, which is going to get more into that good old HIPAA. Intro to CPT. Your second year, you'll have health statistics. Your first year, pharmacology. So this just explains each course a little bit more. One thing with the coding, keep in mind is that with the coding, we have 4 coding classes total. So this first year, they're just going to be introductory, and then it's going to be advanced coding your second year for both of them. Okay, so online, hybrid, video conference. Like I stated, all our courses are online. One thing to remember, professional practice, as I stated, you will have to take time out of your schedule and physically go to your location. The other thing that you need to remember is that, other courses too, culture diversity, you could take on campus if you want to, but these are offered online too. So you could do both, either or, I should say. All right, HIT program goals. We have 5 goals as a program. We have program graduates. They'll demonstrate HIM entry-level competencies. We provide an up-to-date curriculum, resources that prepares students for entry into the profession. We'll demonstrate current knowledge, skills, qualification, and experiences pertinent to the content areas they teach, us the faculty. The HIM program will demonstrate responsiveness to the needs of communities of interest. And then we do have an advisory board that meets twice a year that gives us a little direction. They kind of help us out. And what they are pretty much, they're in their field. They could be directors, managers, and they come to our board, they look at our curriculum, and they just kind of go through what's happening in our HIT program right now. Okay, and then we have our program learning outcomes, which you will see in all the syllabus. Grades. One thing you need to remember in HIT, you have to have a C- or better to move on to another course. So for example, I teach health records management. If you do not get a C- or better, you cannot move on to take coding because health records management is a prereq to coding. Okay, student portfolio, just go through that, is not required, but go ahead and make sure you read through that. Professional practice experience, I kind of talked about those already on how you're going to have 2. We have 2 of them, 4 credits total between the 2. All right, so with that, health-related issues, professional practice experience, PPE, attendance. These are the different things if you do have that. And we'll do a little refresher in the spring over that. Okay, so overview, make sure online students located 100 miles outside the college are responsible for identifying a PPE site by January 1st. Because we don't know a lot of those sites that are over 100 miles outside of Kalmar and Piasta. So we just need some help. We will help you contact, keep in mind, we do, to get you placed. We also, students, remember they're a guest. And this is something I want to talk about, number 5. You can start working on this right now. When I talked about with your physical exam, you need to do that. You need to have documentation on your immunization. So at TB, you have initial 2-step followed by yearly testing. You also have MMR. Varicella, this is going to be your chicken pox. This could be anything. We just need proof. If your doctor's saying yes, they had chicken pox, you can get a titer, or if it was a little blurb in your medical record, Daniel will work that out with you. You need a DTaP. Influenza. Okay, you do need a flu shot. Students can decline to have a hepatitis B and meningitis vaccine. Okay, there is forms that you can decline. With that, with the COVID, I will have Danielle when it gets closer on the COVID vaccination. We have changed policies on this. So when we get around to November, December, when things are starting to click, January, when you're starting to get everything Castle Branch going, we'll talk a little bit more about the COVID vaccination. All right. So make sure here you just read through your responsibilities of professional practice. Unacceptable behavior of professional practice. I'm not going to read through each one, and then dress code. And our grading. The grading, the biggest thing with the grading, we do take evaluations from the supervisor. So that is a big portion of your grade. You need to get a C minus or better to continue in the program. Okay, so these are our HEMA level competencies that we follow. So these domains are the domains that will be on your RHIT test that you will take at the end of your 2 years. We have these domains, many of these domains, many different times and many courses. So not only will you hit them once, you'll hit them a couple of times, 3, 4, 10 times. All right. Graduate surveys. We do graduate surveys after you are done. I talked about professional associations, AHEMA, and the Iowa Professional Association. On that note, I am done with orientation. I will be having a 5-point quiz, and you need to pass that. That way it tells me that you completed orientation. There'll be easy questions, but there'll be just some things that I stated today. Welcome to the program, and glad everybody has started.